Hello. I want to talk a little bit about food allergy testing and maybe even allergy testing in general. Food allergy testing is one of the big things that I do on that side of the practice, right? So I've talked about really, I focus a lot on hormones and digestion. And one of the big things with digestion is understanding what might be causing our body to not absorb nutrients well. We've talked about there are three kind of columns that I put things in, right? There is the idea that maybe there is something wrong with the things that we build, like enzymes and hydrochloric acid and inflammatory markers that might be elevated. So I call that the metabolic and functional aspect of it, right? Secondly, there is dysbiosis, and that encompasses things like overgrowth of bacteria, overgrowth of molds, yeasts, fungus, viruses, in our body, and parasites. And so that is another piece when we look at problems in the digestive tract. But the number one thing I have to say that I get, at least from patients, and that most people are concerned about, and that I love to look at, is allergies, food allergies, right? So we all have this idea that we are walking around with a number of undiagnosed food allergies. And in some cases, that is the issue. Other cases, we look at food allergies, really nothing comes up, and a person can't actually identify from their diet what they might be allergic to. And so it actually falls into one of those other two columns, the dysbiosis or metabolic issue. But when we're looking at food allergies, it's very complex, because remember that food allergies encompass not just a single part of the immune system. We can't simply just introduce a food and know what part of the immune system. So we have these things called immunoglobulins, and immunoglobulins protect us against all foreign invaders, right? They protect us against viruses. So in fact, even when we get vaccines, these immunoglobulins are activated and they form this natural defense. So there is a positive aspect of having these. But when we see these immunoglobulins react significantly in the introduction of a specific food, we start to go, okay, why? What is it? What's causing this? And what should we do about it? So I'm going to just briefly touch on the different immunoglobulins we can look at. And by all means, this is not all of your immunoglobulins, but these are the three that we will look at if we're concerned about allergies, right? Food allergies, or what we sometimes call food sensitivities. So there is immunoglobulin E, or often called IgE. And immunoglobulin E is probably the most talked about, most famous immunoglobulin. Why? Because our traditional allergists, our ENTs, will test immunoglobulin E quite often when they are trying to identify an environmental allergen. For instance, if you have an allergy to cat dander or dogwood or dust, that is probably going to be identified on an IgE skin prick panel, right? Or sometimes even an IgE blood allergy panel. So in food allergy testing, when we're talking about the name allergy, usually if we talk about allergy, true allergy, we are talking about an immunoglobulin E response, okay? We also can say that this is the response most often, but not always, most often that is the most robust response. I say not always because sometimes people have IgE allergies and have no idea that they have them. But let's think about the classic cases. And all of us know someone who is allergic to nuts, especially peanuts, or some people shrimp, right? Where they cannot have those even in close proximity because it might cause the tissue to swell, problems breathing, and then they either have to use an EpiPen or be shipped to the hospital. Those are normally and typically immunoglobulin E responses, okay? So in food allergies, the same thing. And typically we test, when we're looking at immunoglobulin E, we test somewhere around 15 to 20 different foods. Obviously the most popular foods, the ones that we see it happening more often, are the ones that we will test. Those encompass the nuts, legumes, but also peanuts, peanuts like the legumes, and things like different types of fishes. So different shrimp, cod, these type of things, as well as our more normal, at least in the holistic world, allergens like dairy, gluten, wheat, which are often tested separately, by the way, egg, soy, citrus, right? So these are the things we might look at on an immunoglobulin E panel. Now, the other two immunoglobulins I like to look at are immunoglobulin G and immunoglobulin A. So let's start with immunoglobulin G and talk a little bit about what that is. So immunoglobulin G is not just related to food allergies. In fact, when we look at viruses, say we look at COVID, we look at the immunoglobulin G response, which is the long-term immunity. Okay, long-term. It's an immunoglobulin that is not built at the onset of an infection or the onset of an allergy. It's a long-term response to an exposure to a virus, to a pathogen, or to an allergen. So we can look at immunoglobulin G as a long-term response to one of these, and we can look at that in terms of food. What do we look at? Well, with immunoglobulin G, we have to cast the net a little bit wider, right? So immunoglobulin G responses, we often are looking at somewhere between 90 and 180 different foods. There are a number of labs that I've used, and there is one in particular that I use a little bit more when we're looking at that immunoglobulin G response, right? And so what that is, I will say, is typically more of what we call a sensitivity, okay? That can be a misnomer because sometimes it's more than just some little simple reaction. People can have robust reactions. They might break out in a rash, or they might, develop really significant IBS or diarrhea, or they even to the point of having some blood in the stool with some of it. You can also develop things like runny nose, itchy eyes with these immunoglobulin G responses. And they do happen with environmental allergens too, just as they do with food allergens. Immunoglobulin G is, again though, is this more what we would call sensitivity. Why do we call it a sensitivity? Well, frankly, this is really driven again by the mainstream medical community, right? They don't look at IgG as an allergy response, although it's still an activation of the immune system and thus is still an allergen response, okay? The last immunoglobulin we will talk about today is immunoglobulin A, or called IgA. And IgA is the immunoglobulin that often pathogens have first contact with because they have formed and they stay within kind of the mucous membrane aspects of our body, our mouth, our nose, our anus, vaginally. And so we produce immunoglobulin A, and also digestive tract, really important throughout the digestive tract. So it is the first immunoglobulin often that comes into contact with whatever the pathogen is, whether it comes through the eye, the nose, the mouth, immunoglobulin A will first react with that pathogen. Why is it significant? Well, out of the three, it's the one that's tested the least, okay? It's the one that often gets left behind. So sometimes we look at an IgE panel, it's normal. We look at an IgG panel, normal, nothing there, but the person is having responses, especially digestive responses, that make us think this is some type of food allergen. So the last stop is to look at IgA. And IgA is very important, especially when we have an issue with things like gluten or in celiac disease. In fact, one of the markers for celiac is called S-IgA, meaning secretory IgA. And this is really important because secretory IgA can show us that the immune system is being activated in the lumen of the digestive tract, and can be a marker again that actually points us in the direction of a person having celiac. But celiac is not the only thing. So gluten, celiac sprue is not the only thing that can affect IgA levels. Other foods, dairy, soy, nuts, any of these can also still do the same thing. So when we look at IgA, we actually have to look at quite a few markers as well. And same as with IgG, I tend to look at somewhere between 90 and 180 markers for that. Markers being different foods that we test. So anyhow, just as a refresher, there are three parts of the immune system we're going to look at if we do food allergy testing. IgE, which is more of the traditional, more of the anaphylactic, more of the robust reaction. We have the IgG response, which is more of the sensitivity, right? One that we don't always test. one that might just be, some obscure, symptom in the body, a rash, digestive indigestion or stools. And then we have the IgA, which is the mucous membrane, right? The first thing that often these pathogens come into contact with. All three are part of the immune system. So it's not a problem to actually call them allergens. But when we talk with our ENTs, our allergy specialists, they may not see those as valid parts of your immune system. Anyhow, this is all I'm going to talk about today. Hope it helps. Talk to you soon.